What are the pros and cons between fat graft versus blepharoplasty? I have been to about 15 different doctors. I got 15 different answers. What are the pros and cons? Does fat grafting last? Is blepharoplasty too severe? I am a 37-year-old Caucasian woman. Thank you.
Thank you for your question. You're asking about the pros and cons of lower eyelid blepharoplasty versus fat grafting, and you're asking about longevity. And I am particularly appreciate the fact that you went ahead and saw 15 doctors and you got 15 different answers. So clearly you have learned that cosmetic surgery is not a commoditized type of thing where if you choose, you can choose to have a procedure and that is equal amongst doctors. Everyone comes to the table with a perspective. And that's a good take-home message, and unfortunately that's led you to a lot of confusion. So I'm going to share with you my perspective based on the single photo you submitted. So what do we see in this photo? We see someone with relatively prominent eyes. We see someone with relative puffiness under the eyes and hollowness below the eyes in terms of the eyelid cheek junction and the cheek area. So I think that the key to coming up with the best plan for you is by really identifying in your mind the priorities of what affects you the most in terms of your appearance. It is always tempting to have multiple procedures at one time, but what I ask my patients to do is look in the mirror whenever they have kind of like the typical question of, Doc, what do you think I should do? I give them the mirror and I say, where do you look at first? What draws your attention first? And very often we can isolate the top 2 to 3 priorities and address them conservatively. I believe strongly in minimal trauma and trying to get the goals clearly defined. You got 15 different answers from 15 different doctors because when we look at patient, we bring to the table our own aesthetic, our own perception of what you need, and of course what the end result will be. Unfortunately, I do see a good number of patients who come into my practice and are distraught because they had procedures done by another doctor, which I feel were technically very well done, but there was a disconnect between what they wanted and what they ended up having. So even though I look at them and I think they look good, for example, they may have gotten a brow lift and they feel like their expression has changed permanently. They may have gotten very excessively pulled from a facelift. They may have gotten fat grafting and now they look amorphous and irregular. So let's just answer the question about fat grafting first, and I'll just share with you my perspective. When it comes to the lower eyelid area, I feel that fat grafting is too unpredictable for this area. Although theoretically or technically it makes sense to try to restore fat in the lower eyelid area, the fact is, under the skin of the lower eyelids, there's never been a lot of fat. There's the puffiness that's under the eyes that is orbital fat, and that's fat that's in the space around the eye. And so it really doesn't make sense to try to fill out the lower eyelid with fat. The challenge is that not only is the skin of the eyelid so thin that little bumps and irregularities are more common for those who have the fat grafting, and some of the fat makes it and some of the fat doesn't. With any discussion about fat grafting, it is well accepted amongst most cosmetic doctors that 30 to 70% of that fat can get absorbed, which means that in a place like the lower eyelid where the skin is so thin and it shows all irregularities, that you may end up with an undesirable result. I always tell my patients about people who come to me from all over the world who have had fat grafting, and they end up with lumps and bumps, and then the challenge is to try to get to those grafts through different planes of the eyelid in order to reduce the irregularities, and very often that results in potential destabilization of the eyelid structure and requires more than one surgery. So I would advise against fat grafting directly under the eyelid. Now, I do like fat grafting in the cheek area, in the nasolabial fold, and in other areas. And the reason is that those areas, the skin is thicker. And therefore, you are able to place the fat in a space that is likely, even with variable absorption, to not show irregularities. I think that when you're dealing with a face that is relatively hollow, and since you showed a limited view, we have to also consider other lifting procedures, whether it's a facelift, whether it's volume augmentation in the cheek area, or placement of even submalar or cheek implants. So there are certainly many options to explore. In dealing with the lower eyelid puffiness, a slight bit of puffiness, if that draws your eye, then a limited blepharoplasty, such as a transconjunctival blepharoplasty with some reduction of that fat, may help you feel like at least you don't have the puffiness under the eyes. The other challenge is, of course, with relatively prominent eyes, the cheeks, this is the only way to tell really is by side view, but I could probably estimate that what you have is something called a negative vector. That means from the side view, the eyes are more prominent than the cheekbone. And that puts you at relative risk for other complications related to lower eyelid surgery. So in the mix of all of this, and to help you understand my perspective about fat grafting, I would say that if you're going to choose to have fat grafting, don't have it done in the lower eyelid, have it done in the face and other areas. And as I discuss with my patients, always be prepared for more than one procedure if you have a very specific outcome or desired result. And there are alternatives to fat grafting on the face, such as the placement of submalar implants to add volume in this area that often is referred to as the apple of the cheeks. And again, think about your priorities and find a doctor that you resonate with, and maybe take smaller steps. When things get overwhelming, then it is safer to try smaller steps and maybe be more conservative in the beginning before you move forward with a more global, a more extensive type of procedure. So I hope that was helpful. I wish you the best of luck, and thank you for your question.